I am Carol Rosen. I'm a physician and I'm a professor emerita in the Department of Pediatrics at Case Western University School of Medicine. In terms of unmet needs in pediatric sleep medicine, insomnia, behavioral sleep problems, circadian disorders, those are increasing. They account for an increasing number of new referrals to pediatric sleep medicine specialists. The other thing I talked today about was pediatric sleep medicine specialists. We are really linked at the hip, locked to behavioral sleep medicine specialists. And one of the things I talked about today in terms of some of the tensions in pediatric sleep medicine is the under resources that behavioral sleep medicine specialists, those psychologists, are under resourced in pediatric sleep medicine. And they are central to our practice. I also talked about one of pediatric sleep medicine's strengths. We've always worked at the intersection of disciplines, and we have always worked with psychiatrists, psychologists, neurologists, pulmonologists, other pediatricians, otolaryngologists, dentists. That's one of the things we're really good at. And when I talked about what the future was, it was going to be more multidisciplinary. And certainly, seeing children with mental health issues and complicated children on all kinds of psychiatric medications. It's bidirectional between sleep and mental health. And often the first trigger that someone's mental health is kind of drifting off, the first thing to be affected is their sleep. And certainly insufficient sleep, irregular sleep can trigger problems with mood and behavior. Well, sleep apnea, obstructive sleep apnea, will fragment your sleep, and when it's quite severe, you might be exposed to low oxygen. And those stressors, the sleep fragmentation and the low oxygen, they mess with your brain, your learning, your behavior, your mood, and emotions. And so it's important to recognize obstructive sleep apnea, get it treated, and interrupt those stressors on your brain, your mood, and your sleep quality. What the savvy psychiatrist should know about pediatric sleep medicine. So if you asked me 10 years ago, the one thing I was really trying to help them recognize was narcolepsy. The hypersomnolent child, some people might think, oh, that's just all depression. But the hypersomnolence of narcolepsy, it's profound, it's palpable. And, some of my referrals came from psychiatrists. And I think, that was always something I emphasize as a big wake-up call, that neurologic problem, that narcolepsy. I really hammered on that. More, I think psychiatrists got that message. And now I think we're really in a broad partnership. They are sending patients to us. We are sending patients back to them. Maybe one message that I think we're both understanding is that pharmacology, medications, things to knocker you to go to sleep, those are not actually very effective. And dealing with sleep habits, behaviors, and belief, those are actually the more robust therapies to help children with insomnia. So I think I would say that my psychiatry colleagues are evolving. This is not a disorder. Maybe they need those medications for the mental health problem, but treating the insomnia piece, there's a lot of evidence that the behavioral strategies are going to be the most robust, and the pills are just not going to get you where you want to go. We are really looking forward. You know, I actually think that that may put us back in conversation with our parents, put us back in conversation with our patients. You know, right now you walk into the room, you whip out your computer, and you're typing all this nonsense into your note. But what if there's an AI scribe that hears it all, and you can actually look at the patient again, have a conversation, know what, read their cues and their faces, and get back to doctoring again instead of scribing. So I'm actually pretty hopeful about that. Are we there yet? I've been talking to my friends that have AI scribes and the one are pre-AI scribes. I think we're going in the right direction. There's a lot of work to be done. But I actually think that it can get us back to doing what we were supposed to do, and that is looking and talking to our patients. A lot of people are, especially in my demographic, are using medical cannabis to help them get better sleep. But in reality, cannabis is not always doing really good things for people's sleep. And yes, you might get sleepy, and yes, you might get relaxed, but it is, I think we talked earlier about, how do you manage insomnia? The number one treatment are not hypnotics. The number one treatment is cognitive behavioral therapy. And if you haven't gone that direction first, and you are using sleep medications or cannabis, you may be creating some unexpected problems for your sleep, and you may not be seeing the number one treatment in terms of durability. I mean, sometimes there's some addition from the medication that maybe gets some people over the hump. I think as sleep physicians are looking at cannabis, nobody is very excited that this is where we want insomnia care to go.